Understanding students with ADHD. So first today we'll start off asking, what is ADHD? According to the National Institute of Mental Health, Attention Deficit Hyperactivity Disorder, or ADHD, is a brain disorder marked by an ongoing pattern of inattention or hyperactivity, impulsivity that interferes with functions or development. So inattention means a person wanders off task a lot, they lack persistence, and they have a difficulty staying focused. And they're usually also disorganized, but these problems are not due to defiance or lack of comprehension. Hyperactivity means a person seems to move about constantly, including in situations that are inappropriate, so they could be standing up in class when they're not supposed to during a lecture, or just kind of getting up and jumping around. They also could be excessive fidgeting, tapping, or talking. Impulsivity means a person makes hasty actions that occur in the moments without first thinking them through, which could also lead to a lot of potential harm. So some signs and symptoms. According to the Center for Disease Control and Prevention, 6 or more symptoms need to be for diagnosis in children up to the age of 16, and only 5 or more for 17 and older. Again, so there's a lot of look at the inattention and the hyperactivity. People with ADHD show a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. So several symptoms need to be present in 2 or more settings. So like at home, at school, or with their friends even. There needs to be clear evidence that the symptoms interfere or reduce the quality of their school, their social life, their work. The symptoms also need to be not explained by another mental disorder like anxiety, mood disorder, dissociative disorder, or personality disorder. The symptoms do not also happen during the course of schizophrenic or psychotic disorder episodes. So, some signs and symptoms of inattention. So they also often fail to give close attention to detail or careless mistakes in schoolwork, at work, or at other activities. They often have trouble holding attention on task or play activities. They often do not listen. They also do not follow through on instructions and fail to finish their schoolwork, their chores, duties in the workplace. They often have trouble organizing tasks and activities as well. They often avoid tasks that require a lot of mental effort, so like schoolwork, homework, writing a paper, just a lot of things that they're really going to have to focus a lot on. They also often lose necessary objects, so like their school materials, pencils, glasses, stuff that they really should be keeping an eye on, but have a problem with keeping that organized and keeping that. They often are also easily distracted, and they often are forgetful in their daily activities. So some signs and symptoms of hyperactivity and impulsivity include they often fidget with or tap fingers and feet and squirm in their seat. They often leave their seat in situations where remaining seated is expected. They'll often run about the room, climb in situations that they shouldn't be. They often are unable to take part in leisurely, quiet activities due to the talking and blurting out. They often are really on the go, or like they're driven by a motor, just super quick to everything, super a lot of energy. They often talk excessively. They often blurt out an answer before the question has been completed. They often have trouble waiting his or her turn. They also often interrupt. So just like the last one, the symptoms need to be present before they were 12 as well. Several of the symptoms need to be home, school, just in 2 or more settings. And they also need to be saw that they interfere with their social life, schoolwork, or the functioning. So how many students with ADHD are being served in the U.S.? The CDC posts the following data. Approximately 11% of students 4 to 17 years of age have ever been diagnosed with ADHD. The percent has continued to increase from a 7.8 in 2003 to 9.5 in 2007 and 11% in 2011 to 2012. So the map over here shows children that are currently diagnosed with ADHD, with the darker states being where there's more students diagnosed and the lighter states being less. So what are some causes for the increase of diagnosis? According to Time magazine, with the use of statistics from the CDC, they state the rate of U.S. children affected by ADHD are skyrocketing. So one of the main concerns is overdiagnosis. One main problem is a lot of people will just go to their local pediatrician or family doctor for a diagnosis. And however, though, a lot of the pediatricians or family doctors that aren't specialized, they're not always trained in providing the in-depth evaluations and reliable things that they need to diagnose the students. The symptoms should not be just sufficient. There needs to be a lot of intensive outlook into their schoolwork and how they do at home and just everything that shows that it really is affecting their lives. Another problem for overdiagnosis is insurance not reimbursing proper evaluations needed to diagnose. So a lot of the times, a lot of the sessions and treatments and stuff to diagnose are a little expensive and they are not being covered by insurance. So another reason is they have less access to mental health services. So that is another reason that leads to a lot of just family doctors diagnosing it and just throwing out the diagnosis. And then there's a large problem with bypass of non-drug treatment. So a lot of the times, just the family doctors or pediatricians will just be straight to giving out a prescription for Ritalin or Adderall or something. And those have been known to have a lot of side effects like stunting their growth and low weight. And that leads to a bypass of a lot of the non-drug treatments that the family members and the children also need, like therapy sessions and just a lot of one-on-one time to kind of fix the problems without medication. So what category does IDEA place ADHD? Our book states, instead of listing ADHD as a separate disability category, IDEA includes it as a subcategory of other health impairments. Under the IDEA definition, a student with other health impairments has limited strength, vitality, or alertness, including a heightening alertness to environmental stimuli, resulting in limited alertness with respect to the educational environment. And that is due to chronic or acute health problems, one being listed as ADHD. And these usually have an adverse effect to the student's educational performance. So a lot of students with ADHD compared to other students have lower academic achievements, lower grade point averages, and retention rates. They also tend to have lower vocabulary development and working memory challenges that result in problem with reading. So do all students with ADHD demonstrate the same characteristics or degree of behavior? No. So there are actually 3 types of ADHD. There is predominantly inattentive type, there's predominantly hyperactive impulse type, or there's a combined type, which is a mix of both. So some characteristics and behaviors for predominantly inattentive type. The book Exceptional Life states that these students often display a slow tempo in their approach to academic tasks, boredom, lack of motivation, and self-consciousness. The inattentive type has a higher ratio of girls than boys than do the other 2 types. They are more likely to experience anxiety and mood disorders and often have the biggest challenges with academic achievement. Without specific diagnosis and appropriate interventions, these students are at risk for long-term academic, social, and emotional challenges. Without appropriate supports, they can have a lot of difficulty working in distracting environments, um, have a lot of troubles absorbing large amounts of new information, shifting their flexibility from one test to another, or literally linking a series of cognitive operations. Characteristics and behaviors for your predominantly hyperactive impulsive type. So the book also states that these students are often display a slow tempo in their approach to academic tasks, boredom, and lack motivation and self-consciousness. The inattentive type has a higher ratio of girls than boys than the other two types. They are more likely to experience anxiety and mood disorder and often have their biggest challenges with academic achievement. So some characteristics and behaviors for the combined type is the book states that these characteristics are academic challenges, social challenges, and increased prevalence of both internalizing and externalizing behaviors. So they can have a mixture of both types of symptoms. And so classified interventions. So one thing they could do would be goal setting. When the students set goals, they have a personalized meaning that they are more likely to attain that goal. It should be incorporated into the student's preferences and interests of the goal of their motivation. And so one of the teachers at the grade school I work at, they do a lot of quarterly goals on work that they want to achieve for their MAP testing scores and how to raise those and how they're going to attain those goals. Another thing is they can have class leadership notebooks or notebooks that the whole class can use to help organize and color code a lot of their important information. So maybe like their AR reading scores, their math scores, homework folders, just everything that you can incorporate with the whole class that really helps the students with ADHD. You can also incorporate a lot of self-instruction or self-monitoring. You can also incorporate note-taking skills. So you could have a session throughout math talk about how the best way to take notes are. And another thing at the grade school I teach at is during social studies, a lot of the students and the teacher, they have a notebook that's a copy of their social studies book that they can just highlight in, and they go through it together talking about what they need to highlight, what are the best things, and how to take the best notes. And then they can also errorless learning. So errorless learning is an instructional strategy that minimizes the mistakes students make when learning a new task. The book also states that the idea behind errorless learning is that the learning without mistake is more effective and lasts longer. And so the book also states that it's like a lot of stimuli. So taking the student's hand to help them shape a piece of clay is a physical prompt. A verbal prompt can be questions like, does this have 4 sides, in response to the find a square, and changing the instructions. And that is my presentation on ADHD.